fewer workers offers for promotion, and women performing fewer procedures on average than men. The pay gap, however, between men and women specialists was 16.6%. So the reasons for gaps in pay are complex and multifactorial. However, it is broadly acknowledged that the differences are due to more than apparent factors such as numbers of hours worked. Next, mental health. Many students demonstrated the increased incidence of depression and suicidal ideation among medical professionals, and much progress has been made to counter the cultural silence surrounding mental illness. Strikingly, doctors under 30 and female doctors have reported higher level of general and specific mental health problems. Female doctors reported greater work stress for conflict between career and personal family responsibility than male doctors. They were also more likely to report experiencing stressful life events regarding caring for family members, and were more likely to have attempted suicide than male doctors. Surgery is another area to address. Surgery is popular among medical students in Australia. A 2006 survey found that 36% of female and 24% of male medical students would have increased interest in surgical career if part-time training were an option. But enthusiasm diminishes significantly for both genders, particularly for women, by the time they need to decide on a specialty. Reasons include the heavy workload and the desire to have children. Once they become surgeons, however, women are more positive about their career choice than female medical students contemplating such a career. A 2014 literature review on gender-based differences in surgical training found that the lack of role models and gender equality was responsible for the low number of women training in surgery. Women were unlikely to meet the female surgical role model during their training, and were more likely to experience gender-based discrimination during their surgical rotation. Although surgery may appeal to women as a career option, during training, often significant gender imbalances will emerge in their fields, leaving them with the perception that surgery is incompatible with a rewarding family life, happy marriage, or having children. The considerations are also becoming increasingly influential for younger male doctors as well. So, the Women in Surgery section of the Royal Australian College of Surgeons has developed mentoring programs for trainees, which are committed to expand the number of women in surgery and to ensure that training programs do not disadvantage trainees, especially females. The Women in Surgery section committee has been fundamental in the development of some of the college guidelines on issues such as discrimination and harassment and safe working hours. They have also developed scientific and education programs, including the Women in Surgery Breakfast, released a discussion paper regarding flexible surgical training, and have been represented on college working parties regarding mentoring and flexible training. 2011 Medical Journal of Australia editorial summarized the situation that too many medical graduates, particularly women, leave the workforce before completing the training because of difficulty in balancing study, work, and family commitment. The cost is in time and resources for the individual and community is high. These days, 0.3%, almost none, of surgical trainees were currently training part-time, but over 30% expressed an interest in undertaking less than full-time training. Options for flexible surgical training have been explored. So this is the model for one full-time flexible model. Second, standalone part-time model. And third one is a job share model. However, in the surgical area, none of them were proven to be practical. But job share positions within pediatric training are well established and have a number of distinct advantages. So, summary of Australian situation. So, number of female in the workforce over 50%, there is strong movement towards equal opportunity. There is a positive medical education culture and also strong student voice. However, there is inequality in the area, especially leadership, pay, and female presence in surgery. So, Royal Australian College of Surgeons' commitment towards gender equality. So, how to make good use of the Australian model in Japanese culture? So, most important thing is changing the mindset. How? So, raise public awareness of issue in the medical workplace is the one. And also improve awareness and responsiveness in inequality. So, zero tolerance of bullying, harassment, and discrimination is the norm. A sustainable working environment is not only for female doctors, but for male doctors as well. Also, work-life balance is far healthier way of thinking than sacrificing family and private life. Lastly, transform medical education culture is very, very important. So encourage and support female role models, leaders, supervisors, women in surgery. Redesigning the medical education to recognize inherent differences between men and women. Thank you for your attention.
Thank you for your interesting presentation.